My name is DeAndrea Bolden, and you are tuned in to the Faith and Mental Health Podcast. Listen, today, guys, I have an amazing guest with me. I'm so excited. I've been following her and kind of like stalking her a little bit on the internet for a while. I found her on Instagram a while back, but listen, you know how I always do. I'm not going to introduce her. I'm going to allow her to introduce herself.
Well, thank you so much for having me. My name is Dr. Lauren Powell. I am a board-certified family medicine physician, which means I treat patients currently 16 and up in private practice in Sandy Springs. I have a passion about teaching people about food and how we use food to prevent, reverse, and manage chronic disease. I believe food is a powerful drug that we have that is incredibly underutilized. So I feel extremely committed to sharing the power of food. My journey started when my father had a stroke while we were on the phone while I was in residency. It
Oh,
kind of
wow.
completely rattled and changed kind of how I move in medicine because my
Mm-hmm.
father was not a neglectful patient. He was taking medicine in the morning. He was taking a handful of pills in the evening, but
Mm-hmm.
something bad still happened. So that let me know that there was something that we as medical providers were missing in terms of helping patients heal and manage their health. And so I've been on a bit of a food journey in terms of in what form I give this message in. As crazy as it sounds, we know in healthcare how important food is, and yet
Right.
it's not really set up in a way to um, give people that information. It's just not set up. We've got 15 to 20 minutes with a patient. We've got a bunch of boxes to check off. It's a lot of stuff going on. And it's just while these conversations we know are critical and important, it's just not, it's like, where do we have them? And so I've kind of just throughout my last, 10 years have just been doing it in different ways, TV, media,
That's
social
good.
media, print, traveling, do a lot of stuff with churches and teaching cooking classes and just really trying to move people, particularly the Black community, in the direction of better health.
Whew, okay, so you said a mouthful. Listen, you said a lot. Even hearing your story and I don't even think I read that anywhere, or if you did share that, I don't recall about you sharing about your father. But I think it's a lot to unpack because the world of medicine and the model that is used, like you said, there's not an emphasis on preventative care. There's not an emphasis really on a holistic approach in general. And I think we're seeing now where people are interested in that more. And so, and dealing with the Black community, that is a whole another topic. Last year I released a book called Black Health Considered from a Holistic Perspective, and talked about a plethora of things such as rest, diet, exercise, mental health, removing stigma, all these things. And so you unpacked a lot. And so when we talk about food, I want to take a step back. I like what you said when you were talking about your dad. You said something that was important, and before you even mentioned the health of Black people, it like was a light bulb in my head because a lot of Black people that I know, let me just make it personal, can be medically non-compliant as far as
Yeah.
taking medicine and following the doctor's orders. And so you, like you were saying, he did what he was supposed to do and something still happened. And
Yep.
so talking about the nutrition piece, I just don't really think people get it. I just hung up with someone and I said, hey, with the things you have going on, please make sure you're not eating fast food. I eat Chick-fil-A. I was like, that's fast food.
Very
Well,
much is.
yeah. And so, I really want to dive into this diet piece because your nutrition and your diet can affect your physical health. It can also affect your mental health. If things get out of whack, we understand that different components of us, they overlap, and so it can become a snowball effect. So let's dive in there. Let's talk about. I want to talk about diet and nutrition from a healthy perspective, and not from the. And I know you're not going to come with the fad diets, but I do want to kind of touch on those. And even people need to understand the importance of nutrition, making sure they have the right vitamins and minerals in their bodies. And I was one that I always was told, take your vitamins and this, but we weren't told why. We didn't
Mhm.
understand the role that they play in the different biochemical processes in the body. And so I want you to take a moment to really lay that out and just kind of share that with people that are listening.
Well, I think the reason why we're seeing generational patterns of food-related diseases, generational patterns of mama got diabetes, daddy got diabetes,
Mm-hmm.
auntie, uncles, the reason why we're seeing generational patterns of hypertension, of obesity is because we're all living the same.
Yeah.
So yes, there are genetic components to diseases, but I think greater than that is our lifestyles are the same. We're all eating garbage, we're all not moving our body, everybody is stressed and nobody is sleeping. And it just becomes this thing that we do
Yeah.
generationally. And so I think it's about really breaking those generational patterns. And I think there's a big gap in knowledge. We have more medication to treat diabetes than we've ever had before, but diabetes is more prevalent than it's ever been before. We have
Right.
more medicine to treat obesity than we've ever had before, but obesity rates are higher than they've ever been. So it's not a lack of treatment. We have lots of treatments. That's not the problem. The problem, I believe, is truly, truly an educational piece. And I feel like when I see patients, I'll see patients who have diabetes for years and they don't know that they shouldn't be drinking soda. No one's told them
Yeah.
that.
Yeah.
And so it's these things which we think maybe are fundamental, but like they're not, or they're fundamental, but we're not doing, or we need a reminder, or it's just not clear.
Mm-hmm.
So I think, um, one of the things I ask patients is to start doing is just to, can we get back to kind of making our own food? Because the
Yeah.
problem is we don't really know what we're eating. We
It's
don't
true.
really know what's in it. And so even if somebody said Chick-fil-A, I would be happier if they went home and made a chicken sandwich. You're not even changing you're not even changing the what you're eating, but I can guarantee you that you can make it better and healthier and have more control of what's in it if you make it at home. So
Very
I think
true.
really just getting back into like, let's make our food at home. Let's know and understand what we're eating in our body. And I really try to come from not in like a lecturing or but really in an
Yeah.
empowerment. It's like food is a tool that you can use. There's so many things that we can't control. Sometimes we can't control our work situation. We're in a
Right.
stressful job, but it's kind of like this is what we got to do for our family. Like there's so many things in life that we really don't get a choice in, but I feel like our food, we can make some choices. And so
Very
really
true.
it's just like an empowerment piece and trying to empower people with the food that they put in their body.
I love it. I love it. And so, listen, I don't really think people really understand the power of nutrition and food. And so, for me, I worked in food manufacturing for years, and I have tried to give people clues and explain the things and explain to people how much sugar is in the food, how many chemicals. There's so many chemicals in a lot of the things that people are eating. And I really don't think we know. I was talking to my parents. My parents are baby boomers. And I
Mhm.
told them that our generation, probably people maybe mid 40s on down, you know, junk food was the norm, fast food was the norm. We didn't know that it was anything wrong with it. We
Yeah.
didn't know that it was could have a negative impact on our health. And so now that we're more aware, we're trying to spend our days trying to relearn, to unlearn, and to
Mhm.
build better habits. One thing I'm really trying to get into is, even though there are healthy options in the store, even trying to find ways to get into gardening,
Yeah.
or buying things direct from a farmer that is committed to not using certain chemicals and pesticides and different things like that on the food that they grow. And so I want to talk a little bit. I want you to talk a little bit about how food can affect even our mental health.
Yeah, I mean, food is a drug, and so it's gonna affect all parts of our health. Um, if you don't eat well, I mean, there's data that shows how our nutrition directly affects our mood. It directly affects depression, anxiety, our ability to focus.
Yep.
And I think in general, if you're not eating well, you just don't feel well. Like if you're eating a diet that's highly processed, that has lots of sugar,
Mhm.
that's not serving your body well, like you just overall won't feel well. And it may be a mixture of just fatigue, sadness, feeling down, just not feeling like yourself. So it's going to affect all parts of your health.
I like I'm thank you for sharing that and for letting people know like hey there's statistical data behind that to back that up because anxiety as you know is one of the most common diagnosis when it comes to mental health disorders and depression is also high up on the list too and so I'm really wondering what we can do to help promote diet more for wellness, what we can do to help people even recognize that, hey, although your food may not be the cause of everything that's going on with your mental health, eating a healthy diet works in your favor. It doesn't work against you. So even though it may not be the reason why, it doesn't work against you. And so just wondering what can we do in the faith-based community and the Black community, just in our communities and in our spaces, what are some things we can do to help I guess kind of spread the knowledge, help educate, help people become more aware. What are some things we can do? What are some resources? Just for all of us to kind of play our part in this.
Well, I mean, I'm glad that we can openly talk about faith here, because there's a lot of places I go to and like it's just not really a place where you can, or it's not necessarily open to having like those conversations. But
Yeah,
I mean, like when I talk to churches and I have like a very strong passion for working with churches and believers because I feel that we're called to be different. I feel like we're called to
yeah,
talk different, love different, give different,
that's good.
and our health too. Our health should be different. We should be strong. We should be it takes strength, physical, mental, spiritual, to do what we've been called to do and to serve in the way we've been called to serve. And so
True.
health to me, for me personally, has been very, very spiritual. It's been like, this is my body that, God has given me, and I'm trying to honor it so that I can do what He's called
That's
me to
good.
do. And it's very and it's spiritual to be healthy. Like it's spiritual, it requires that spiritual framework for me to stay in it, like to stay making the good decisions, to stay cooking my food when it'd be easier if
Yeah,
I could just run and grab something really quick. Like it literally takes prayer and like spiritual guidance for me to like cook for my baby when I don't feel like it and I'm tired and I would just rather grab
yeah.
something easy, right? But it's like
Mm-hmm.
it literally takes faith. So I feel like, as a person of faith, I think to just draw on that and know that we're called to be different. And I think we know that when it comes to certain areas of our life, but we may not think about it from a health perspective. But sometimes God can only take us as far as our body can handle. And if
Jeez, that
your
was
body
good.
physically can't handle more, how is he supposed to give you more? And I feel like a lot of people's, especially when I see these young folk, and, patients of mine that,
Mm-hmm.
they go to the hospital after having like a massive heart attack or something in their 40s or
Jeez.
50s. I know that their um, job, their mission on earth, I believe it was cut short. God didn't cut it short, but we cut it short. We cut our mission short.
Jeez, that's true. That is very true.
So, when I talk to my other colleagues, I call it like a slow suicide. It's like a
Wow.
slowly killing yourself.
Wow. That is I you said a mouthful because I remember my personal trainer. I've gone to the same trainer on and off for the past couple years, and he said I can't work for Christ in the grave,
Mm,
and he said I don't want to find myself having having to answer to the Lord early because I got there before my time because I wasn't a good steward over my body. And I'm glad you really laid that out there because I don't think, especially in the church world, that there is a great enough emphasis on taking care of our health. And when we take it and we kind of niche it down all the way down to the predominantly Black church, we see a lot of the same health issues in and out. So in the Black secular spaces and in the Black faith
yeah.
spaces, we see the same health issues. We see the same things. And you're right, where we're not treating our body like the temple of the Lord. We're not seeing the spiritual benefits of it. I remember this literally happened to me. In the summer, I'm in Michigan, so it's cold right now, so I don't go out as much. I do like to try to walk in the winter some, but it had been unbearably cold. It was like down to -25. But anywho, back in the summer, I would take photos of me like working out, trying to encourage and motivate people to work out. And people would come on my page and say, exercise profits you nothing. And I'm like, yeah, spiritually it profits you nothing, but physically it could give you more years. Physically, it could keep you from getting sick.
Yeah.
Physically, it can allow you, like you said, to be strong enough and well enough to do the work of the Lord. We can't keep running around on oxygen tanks trying to do the
No.
work of Christ and not be good stewards over our body. And so yeah, you really that is a great topic in itself, and it really needs to be addressed in the church because we're not good stewards over our bodies. We don't take care of ourselves. We've seen go to church, get out of service, eat a big feast of bad food, and then lay down and take a nap and say, I got the itis, and then get up, rinse, repeat.
Yeah, it's just not. And you thinking about like I think about like the army of the Lord, like in a true war, like what would our soldiers look like?
Oh my gosh, don't.
Would we be able to pick up our brother or sister or care, like
No.
physically, what could we do? Could we fight?
Yeah, that is very true. I
And
remember I asked people, I said, how can we say brag about he's given us the keys to the city and we can barely make it from one pew to the next. And so I think that there is a clarion call that we need to answer to get, excuse me, to get our health in order. And that starts with our diet and adding movement to it and exercising and taking it serious. One thing I put a quote I think it was I can't remember if I put the quote if it was in my book or if I just put it on my social media. But basically, a lot of people don't make their health a priority until they lose it. It doesn't.
Mhm.
It's like health doesn't matter. We take health for granted because it's there. We're
Yeah.
especially people that were born in good health, and we know everybody doesn't have that testimony. But for
Yeah.
those that were born in good health, we never consider our health until we get bad news or until we start to lose our health or until things start to go left. And then a lot of times, unfortunately, I see where people expect the medicine to do all the work while still eating candy bars and Doritos and Big Macs and Whoppers with cheese. And I try to explain to people that yes, you're wondering why your dosage is going up and why you're on multiple medications because you're eating against even what the medicine is trying to do. You're eating against it. You're working against it with your diet. And so I want you to speak a little bit about the dangers of being non-compliant as far as just thinking that the medicine will do all the work while ignoring doctors orders or suggestions, however you want to put it, as far as cleaning up their diet and exercising.
Yeah, I mean, that's what I, saw with my dad, and it was a reflection that I was seeing with my patients in terms of people taking medication, but without changing their diet, without changing what they're drinking, without consuming their life, without changing their
Yeah.
lifestyle, bad things are still going to happen, and they do. I would, I'd probably venture to say that the majority of people that are admitted to the hospital right now probably take medication.
Okay.
So what does that mean? It means it wasn't enough. That means there's some other things that have to happen. And a lot of times, even with, and I'm not anti-medication, I'm very much, to use medication when it's appropriate.
Right.
Um, but it's not enough. And so when I'm trying to talk to patients about changing their lifestyle and their nutrition before medication is indicated, I'm trying to save them from being on medication. But once when they're on medication, the lifestyle stuff it's a non-negotiable. You have to do that, because now we're not trying to necessarily prevent disease. Disease is already evident, which is why you're on medication. And we're just trying to prevent something bad from happening. We're trying to prevent it from progressing to something worse. So I always ask patients, don't wait until you feel bad to do something different. Don't wait until something bad happens
Mm-hmm.
before you do something different because it may be, it may be too late.
Okay.
Sometimes things happen and
Oof,
we don't get the opportunity to be like, okay, let me live a little bit and do a little bit different. Sometimes that's not always the story,
it's very true.
unfortunately.
That is very, 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 very true. Yeah, I won't even go there. but yeah, it's so important that, we do what we can. And the thing is that I want to say this, and I know you've probably seen this even as a physician, even if we do everything right, we still things can still happen,
Mm,
because there's genetics, there's other factors, there's environmental factors. We're
yeah.
finding out about the PFAS, and the plastics and everything. And so there's some things that are outside of our control. And so we want to make sure we do all that we can do within our power. And so I
Yeah.
want to say that to encourage people, and for those that, are believers, is we trust God with, if we're doing all that we can do, is that, other than that, we're in his hands. um, but I wanted you, before we got off here, I wanted you to talk a little bit. I want to shift a little bit from diet. I want to talk a little bit about the importance of rest, getting enough sleep. I don't think people really understand what happens to the human body when we're sleeping, and like how our body is able to help with the regulation of things like blood pressure and blood sugar when we're sleeping. Also, and a little bit, if you can address chronic stress. I don't think a lot of people really understand that stress include. I don't know why I'm saying include increases our
Mhm.
risk for a lot of things, including type 2 diabetes, high blood pressure, and things of that nature.
Yeah, I mean, rest is extremely important. It's extremely restorative to the body. It's when there's a lot of processes that are going on in our cells. That's when things are cleaned up, bad cells are getting rid of, new cells are being formed. And so rest is extremely, extremely important, not to mention all the things that are going on in the brain, um, processing and just different things that are happening in the brain that are important for rest. When people don't sleep, you have a dysregulation of your hormones, you have inflammation that's going on. And what happens is I usually see it manifest people's blood pressure becomes hard to control. I'll throw all kind of medication at them, but their numbers aren't going down. It's usually, and I talk to them about their sleep, and lo and behold, they're not sleeping. And I say a lot of people don't sleep well. So these are the questions that I ask when I'll say to someone, "Do you sleep well?" And they say, "Well, what does that mean?" To sleep well means that you fall asleep easy, meaning in 15 to
Yeah,
20 minutes you're asleep. You shouldn't be having to sit there for hours and hours and hours to try to fall asleep. You fall asleep, will stay okay. You stay asleep and you wake up and you feel rested. It's not like you feel like you never slept or you need to get back in the bed.
got you.
You should wake up and should feel rested and you should feel ready to conquer your day. If that's not happening, you need to talk to a medical provider to make sure there's not something going on, to make sure you
Got
don't have
you.
something called sleep apnea, which so many people have, and I'm seeing it in younger and younger folks, which is where there's really a disruption in your sleep cycle due to periods of apnea or not breathing. And usually we see that in snoring. People have normalized snoring. Snoring is not normal. So if you're having periods of snoring, my guess is that you're probably having disruptive sleep and you would benefit from a
Mm,
sleep study and having it addressed. And what I notice is a lot of times people don't know that they can feel better until they feel better. Like they
yeah.
don't know because they just kind of gotten used to it. I mean, I talk to women all the time who are like, "Yeah, I haven't slept in 2 decades. I just thought it was because I was a mom or I'm just busy and it's just, but and sometimes that's due to hormones. Women in perimenopause, menopause, and postmenopause can have some hormonal dysregulation that
Yeah.
can make sleep difficult. So again, those three questions: Do you fall asleep okay? Do you stay asleep? And do you wake feeling rested? If your answer is not yes to all of those things, you should be talking to a medical provider about it to get your sleep evaluated because sleep is so important.
Yes.
It's so important.
Whew. Listen, health is wealth, and this has been a very, very informative conversation. Um, that will hopefully push a lot of us in the right direction. I know for myself, I started making a lot of changes probably 10 years ago. I stopped eating pork. I stopped drinking pop. I rarely ever drink juice. I mostly drink water. I'll have a little tea, a little coffee every now and then. Definitely been working on the cooking more at home and all that stuff. And so all we can do is try to make the necessary changes. And I think sometimes that I don't know what it is in our brains. I don't know if it's an American thing or just a human thing. It seems like when things are too simple, we don't believe it works. We in our mind it has to be complicated and there has to be 30 steps. And it's like, no, you mean not eating a candy bar and eating an apple instead could actually be beneficial to my health? And it's like, yes. And so this has been a very, very informative conversation. And so I want to thank you for joining me and being my guest today. For those that are tuned in again, I've been live with Dr. Lauren. And so I'm going to allow her to close us out. I want her to tell you how you can connect with her, tell you about her products, um, how you can find her on social media, and all those good things.
Awesome. Well, thank you. Thanks for the conversation. I feel like there's so much to talk about in this space, but I feel like if you can walk away with just kind of one tidbit that you can implement in your life today, I feel like that you've won, you've gained something. So I hope that the listeners can glean at least one thing from our conversation today. I'm on social media at Dr. Lauren Powell everywhere on Instagram and LinkedIn, and Facebook and YouTube. I'm on a television show called Urban MD TV where I'm one of the co-hosts. Urban MD TV is like the first and only national TV show that talks about health through the lens of Black people and minority people. And we're talking about minority health through that lens. So it's an amazing show. It's on Fox Soul, PBS, and local Fox stations. Season 1 is already out, so catch season 2 in September. Let's see what else. I have a seasoning. It's called the Doctor Seasoning. So if you're someone that likes to cook, wants to cook, is it confused about cooking, it's a great seasoning because it's safe for
Nice.
everything. It has little salt, no sugar, no additives. My mom and I make it from scratch, and it literally can go on
Nice.
everything. We put it on our chicken, we put it on our fish. I make salad dressing with it. I make marinades with it. I put it in my pasta sauces, all my vegetables. It's just a super easy, clean dressing. If you go to my website, drlaurenpowell.com, and click shop, you can find out more about that. I have a lot of offerings in Atlanta coming soon. So if you're somebody in the Atlanta area, please follow me on social media. I'll be discussing more about that and just other ways that I'll be sharing about using food as medicine and being of service to people in the state of Atlanta. But other than that, find me on social, check out the show, shoot me a DM. I respond to all my messages. So would love to connect.
Awesome, awesome, awesome. And so thank you again to Dr. Powell for being my guest today. And thank you for everyone that tuned in. Until next time.